October 20th is World Osteoporosis Day. So what is osteoporosis? Osteo is a word that refers to bones. The term porosis means porous, which can mean having pores. Osteoporosis can then be defined as having pores in the bones. Normal bone does have small pores, or holes within its structure. However, osteoporotic bone has much larger pores or holes. Symptoms of osteoporosis. Osteoporosis is a silent disease that usually has no symptoms until fractures occur in the body, prompting investigation into the reasoning for the fracture. Fractures can occur in any bone in the body, but occur most commonly in the wrist, spine, and hip. Bone is considered a type of tissue and is a living tissue, just like other tissues in the body. New bone is constantly being created, while old bone is then removed or broken down and replaced. This exchange of new and old bone is done at an equal pace. When the exchange becomes unequal, osteoporosis occurs. Old bone is removed faster than new bone can be created. This can cause bones to become weak and more susceptible to fractures. Who does osteoporosis affect? Osteoporosis can affect men and women of all ethnicities and races and can also occur at any age. It typically occurs as men and women get older. Osteoporosis occurs more in white and Asian women, with the highest occurrence in women who are postmenopausal. Although Hispanic and African American women are at a lower risk, there is still risk. Osteoporosis is more common in white men as compared to Hispanic, African American, and Asian men. Here are some interesting statistics. According to the International Osteoporosis Foundation, worldwide, osteoporosis can cause more than 8.9 million fractures annually, resulting in an osteoporosis fracture every 3 seconds. Worldwide, 1 in 3 women over age 50 will experience osteoporosis fractures, as will 1 in 5 men aged over 50. Nearly 75% of all hip fractures occur in women. Men account for 25% of hip fractures occurring in the over 50 population. 5 to 10% of patients experience a recurrent hip fracture. Of these, 23% occurred in the year following their first hip fracture, and 70% within the first 5 years. Screening for osteoporosis can include a patient's medical history, age, menopausal status, family history of osteoporosis, fracture history, diet, exercise habits, alcohol use, smoking history, diseases and disorders, medications, and treatments. In addition to a patient's personal medical history, a non-invasive and painless exam called a dual energy X-ray absorptiometry test, more commonly known as a DEXA test or DXA test, can be performed. A DEXA test or scan measures the bone mineral density or BMD in bones. It uses very low dose X-rays to penetrate bones, combined with the computer to measure how dense bones are. A type of screening using ultrasound can be used to evaluate the heel to determine if an actual DEXA scan is necessary. A peripheral DEXA uses the wrist or the heel and can determine BMD. The most diagnostic type is a DEXA of the hip and or the spine, usually the lumbar area. Osteoporosis can be prevented or minimized with preparing early in life, with daily weight-bearing exercises, eating a healthy diet that contains calcium and vitamin D. Calcium cannot be absorbed by the body without vitamin D. Even with sufficient exercise and calcium and vitamin D, osteoporosis may be inherited. Medications may be necessary to prevent and or treat osteoporosis. Alcohol should be consumed in moderation. If a person smokes, quitting smoking can help prevent osteoporosis. And if possible, decreasing the use of glucocorticoid or steroids. Other medications to be aware of: certain hormonal cancer treatments, SSRIs, PPIs, and anti-epilepsy medications can contribute to osteoporosis. Treatment for osteoporosis includes diet, exercise, calcium and vitamin D supplementation, and medications such as bisphosphonates, parathyroid hormone calcitonin, hormone therapy, estrogen, and many others. If you have any risk factors described, be sure to talk with your medical provider. Prevention is key, and treatment is available if osteoporosis is present. Thank you for watching. Find me on YouTube, Instagram, TikTok, and Twitter. Be sure to follow, like, share, comment, and subscribe. I am Nurse Master Charlie.